Welcome to RelapsePreventionPlan.net's free online rehab lessons. We believe that it's never too late to learn to prevent relapse. This presentation is on medications and relapse prevention. The learning goals for this presentation are to describe 3 types of negative drug reactions and 4 drug categories that react negatively with alcohol, to list 3 ways in which a doctor or pharmacist can make an error in prescribing medication, and to list 5 questions you will need to ask a pharmacist about any new medication. You're in charge. You are the person who is responsible for your life decisions. Planning ahead and being vigilant for possible problems is part of relapse prevention. Half of the modern drugs could well be thrown out of the window, except that the birds might eat them. Prescription drugs can cause problems. Prescribed medications can negatively interact with other prescribed or over-the-counter medications you may already be taking. You may have a negative reaction due to an allergy or other medical condition. Some prescription drugs contain opioids, amphetamines, or other drugs which you should avoid as it may lead to relapse. Professionals try to help. Most doctors and pharmacists act in your best interest and will listen attentively to your complaint, do the appropriate tests to help make the best treatment choices, and provide you with the best prescription to manage your illness. But it's your job to ask questions and give accurate information. Despite your physicians' and pharmacists' best intentions, they can make mistakes because they may be busy and not listen as carefully as they should, not ask you the right questions, or assume a drug is the best and quickest answer when for you, exercise, change in diet, or the like may be a better alternative to achieve the same outcome. Ask many questions and give accurate information to your professionals because your physician and pharmacist may not take into account your past addiction and unintentionally prescribe a drug which cues you to want to use again. They may not know all about your health conditions, and they may not know all the medications, including prescription and over-the-counter drugs that you are now taking. And you may not have told them everything they need to know to make the correct diagnosis or choose the best prescription for you. It's your job to protect yourself and to make sure that you only take medication when it is a better alternative than no medication, that you get the right medication, and that your doctor or pharmacist has all the right information about your health, including your health history and your decision to not take drugs which will cue you to relapse. How to manage your medications. Keep a complete list of all the vitamins, medications, and other over-the-counter drugs you take. Use the internet, the library, and your pharmacist to stay well informed about all vitamins, prescription medications, herbal remedies, or over-the-counter drugs you take. Stay informed and communicate. When a new medication is prescribed, tell your doctor or pharmacist all the other drugs and herbal remedies you are taking. Ask questions about possible side effects or problem combinations. And keep books on hand that will increase your knowledge about prescription medications and consult them before agreeing to take any new medication. You can't ask good questions if you are not informed. The best way is to always find alternative solutions to health problems instead of taking pills. As your first choice, try alternatives to medications. If you are having problems sleeping, use relaxation techniques. If you have back problems, use specific exercises for back conditions and lose weight. If you're anxious, use exercise and activity. If it is a time-limited problem, such as a sore back due to having your period, just wait it out. Other ways medication problems can occur are that you may see several doctors at the same time for different conditions. A cardiologist prescribes heart medications, a psychiatrist prescribes antidepressants, and a GP prescribes an antibiotic. Negative drug interactions are more likely if you and your doctors have not communicated about your different prescriptions. And if you're also taking over-the-counter medications or herbal remedies. Drug interactions can cause you problems. Number one, they are additive. The most common interaction occurs when one drug adds to the effect of another. For example, some headache medications in combination with alcohol cause exhaustion. Or they are antagonistic. One drug cancels out the effect of another. For example, Prozac, taken with the allergy medicine Periactin, loses its antidepressant effect. Or unpredictable, the unknown consequences of combining a drug, usually a new one and another drug. Overprescribing causes problems too. The correct drug may be prescribed, but with the wrong dose. The medical problem for which the drug is prescribed is unresponsive to the drug. For example, antibiotics prescribed for colds caused by viruses. And a drug is prescribed when a lifestyle change is a better solution. For example, a sleeping pill for insomnia rather than exercise. Misprescribing also causes problems. Physicians may treat what is really an adverse drug reaction with another drug instead of stopping the first drug. Provide a newer, less well-tested drug when one with a proven record would work. Or fail to take into account what other drugs you are using and their effects when combined. Using alcohol with these drugs is dangerous. Alcohol plus sedatives. Sedating effects can lead to impaired judgment, coma, and death. Alcohol plus anti-anxiety medication can cause sedating and severe drowsiness, leading to accident and injury. Alcohol plus antibiotics can cause nausea, vomiting, and even seizures. Using alcohol with these drugs is dangerous. Alcohol plus anticoagulants or blood thinners increase the risk of bleeding, except in chronic drinkers where it decreases the action of warfarin and can cause blood clotting. Alcohol plus antidepressants impairs mental and physical skills. And alcohol increases the action of some and decreases the action of others. It can get pretty complicated. Combining alcohol and any of the following drugs is dangerous. Alcohol plus antihistamines increases sedative effects and the possibility of accidents. Alcohol plus anti-seizure medication increases the availability of Dilantin in the body and increases the probability of side effects. Chronic drinking decreases the availability of Dilantin and increases the risk of seizures. Alcohol plus heart medication causes dizziness and fainting and reduces effectiveness. Alcohol plus narcotic pain relievers magnifies the sedative effect and increases the risk of overdose. Alcohol plus non-narcotic pain relievers increases the risk of stomach bleeding. And some medications endanger your recovery. Any substance with addictive potential or mood-altering properties can lower your resistance to and precipitate a return to alcohol and drug use. Individuals vary in the extent to which their resistance is lowered, and therefore it is advisable to err on the side of safety and caution for your relapse prevention plan. Avoid all narcotics or controlled substances and use alternatives for pain control whenever possible to avoid relapse. Be alert to medications that contain a mixture of drugs. Be alert for pain control drugs that may contain combinations of chemicals and avoid them. Drugs that may have added compounds are codeine or codeine compounds, opium, barbiturates, oxycodone compounds, morphine or morphine compounds, fentanyl, and meperidine. If you are unsure, check with your pharmacist and ask if the drug has any mood-altering properties or addictive potential. Ask your pharmacist to recommend to your physician a safer alternative for you. Doctors don't know everything, really. They understand matter, not spirit, and you and I live in spirit. What is a pharmacist? A pharmacist is a licensed healthcare professional governed by legislation or law who must follow a professional code of practice. They are an expert on all prescription and non-prescription medications, and they are a graduate of a university with a Bachelor of Pharmaceutical Sciences degree or the more advanced Doctor of Pharmacy. Pharmacists can help you. They are your second line of defense against wrong medications. In consultation with your doctor, they can recommend medications that may have not been considered. They can talk with your doctor on your behalf. They can explain possible side effects to you, and they may provide cheaper drugs that have the same effect. If informed of your former addiction, pharmacists can help you by recommending medications that will support you in relapse prevention. Some questions that you can ask your pharmacist are, why am I taking this medication? How and when should I take this medication? Is 4 times a day the same as every 6 hours? Do I have to get up during the night to take my medication? Do I take my medicine with food or water? Is there anything I should or should not eat while drinking or drink while I am taking this medication? What should I do if I miss my dose or take 2 doses close together? How will I know if this medication is working? I have allergies, so is it safe for me to take this medication? Are there any side effects I should watch for, such as, will it make me sleepy? Will my medication interact with other drugs? Will my prescription be affected by over-the-counter medications like painkillers or antacids? Will it be affected by vitamins or herbal supplements? Can I take this medication if I am pregnant or breastfeeding? And when should I begin to feel better? If I feel better, can I stop taking it? And when should I see my doctor? Where and how should I store my medication? Self-reliance is the only road to true freedom, and being one's own person is its ultimate reward. So what it comes down to is that you have made a commitment to a life free from addiction. So as part of your relapse prevention plan, set goals to use alternatives to medication whenever possible, become informed about prescription and over-the-counter medication, use your doctor and pharmacist as partners, and use the library and the internet to become your own first line of defense. Here are the references for this presentation. In this presentation, you have learned to describe 3 types of negative drug reactions and 4 drug categories that react negatively with alcohol. You learn to list 3 ways in which a doctor or pharmacist can make an error in prescribing medication. And you learn to list 5 questions you will need to ask a pharmacist about any new medication. Remember, this video is not a substitute for proper medical care and consultation with your physician or qualified healthcare professional. Don't ignore professional advice or delay seeking treatment based on the information in this video or on this YouTube channel. And if you haven't already, please visit relapsepreventionplan.net and download our free book, Make Your Last Relapse the Last. Thank you for joining us. You can do it. We believe in you. Don't give up.